Okay, let's unpack this. Imagine a really serious infection, but deep inside, the skull. Today, we're diving into source material about something called intracranial abscess.
That's right. And it's not just one thing, really.
No.
It's kind of a category for infections inside the head.
Right.
So that could be infections in the brain tissue itself,
Mm,
cerebral abscesses, or infections just sitting outside the brain's lining, maybe under the skull bone.
hmm,
They're all challenging just because of where they are.
definitely. So our mission here is to explore what these sources are telling us about this condition. How do these serious infections even start? And specifically, there's this one supportive treatment mentioned, hyperbaric oxygen therapy. We want to see what the texts say about who it might be for and, well, why it might help.
Yeah, and what's really striking from the sources is where these infections can actually come from. It's often not, starting right in the brain.
Oh, really?
Yeah, they can spread from things that seem simpler, like a persistent sinus infection, maybe an ear infection, sometimes even dental work. And the sources also mention they can travel through the blood from infections elsewhere in the body, or maybe after head trauma or some kind of surgery.
Okay, so if you or someone you know were facing something like this, the standard approach described in our sources sounds pretty intense.
It is. Typically, it involves surgery, to drain out the infected material,
Right.
and then hitting it hard with powerful antibiotics to kill the bacteria. But, well, medicine knows not every infection plays by the rules.
Exactly. So what about those trickier situations?
Well, that's what the sources detail. Maybe you've got several pockets of infection, not just one. Or the abscess is way down deep in the brain, somewhere that's really difficult or, frankly, risky to get to with surgery.
Okay.
Or perhaps the patient's own immune system isn't quite up to the task of clearing it out, or they just haven't responded well to the first round of antibiotics. These are those really complex cases where you start thinking, okay, what else can we do to support the main treatment?
And that seems to be where the sources bring in this other strategy. It's quite fascinating, actually. They talk about hyperbaric oxygen therapy, sometimes called HBO2, but specifically as an adjunctive treatment.
Exactly. Adjunctive is the key word.
Mhm.
It means alongside the surgery and antibiotics. It's never suggested as a replacement on its own.
Got it. So how might it actually help in these tough spots?
Well, the sources suggest a few ways that flooding the body with pure oxygen under increased pressure might be beneficial. Think about it. These deep infections often create little zones with really low oxygen levels right inside the abscess.
Ah,
And
okay.
that's like perfect conditions for certain kinds of nasty bacteria, especially the anaerobic types that actually thrive without oxygen.
So the high oxygen makes it a hostile environment for them.
Precisely. It can make that environment toxic to those specific invaders.
Hmm.
The sources also suggest this high-pressure oxygen might help reduce the dangerous swelling that often comes with these abscesses.
Which is critical inside the skull, right? There's no room for swelling.
Absolutely critical. And there's more.
Mhm.
It might also boost the effectiveness of certain antibiotics, help them get into the abscess and do their job better.
Okay, interesting.
And finally, the sources mention it could potentially give your own body's defenses a bit of a lift, helping your immune cells, like certain white blood cells, work more efficiently to clear everything out. So it's potentially working on several levels.
So it sounds like it's not for just any intracranial infection then.
Definitely not.
Right.
When you look at who the sources suggest might benefit, it's really targeted at those complex challenges we talked about.
Like multiple abscesses.
Yes, or ones in difficult locations. Patients maybe whose immune systems are compromised, people who might not be great candidates for really extensive surgery, or just cases where the standard treatments aren't quite getting the job done. It's presented as a tool for those real uphill battles.
And what kind of evidence or experience do the sources discuss?
They review clinical experience, mostly things like case reports and small series of patients. You can think of these as sort of early looks or detailed accounts of how the therapy was used in specific, complex situations.
And the takeaway from those?
They seem to suggest potential benefits when HBO2 is used carefully in these selected patients. And, importantly, they note that the therapy itself generally seems to have a low rate of complications.
Okay, so wrapping this up, what's the main point we can pull from these sources?
Well, it seems clear that aggressive surgery and the right antibiotics are absolutely the foundation for treating intracranial abscess. That's non-negotiable.
Right.
But the sources highlight hyperbaric oxygen therapy as a potentially valuable additional tool, something explored and used specifically for those really complex, challenging cases.
So not a magic bullet, but supportive.
Exactly. It's presented as support when you're facing big hurdles like those multiple infections, the hard-to-reach spots, or maybe when the patient's own defenses need a boost.
And for those carefully chosen patients, the sources seem to suggest the potential benefits of adding this therapy look favorable compared to the risks, which are described as generally low.
Yeah, that seems to be the picture painted by the sources, which really makes you think, doesn't it? Consider how medicine keeps looking for innovative ways, like this supportive therapy, to tackle some of the toughest infections in the most delicate parts of our bodies.